GERD means gastroesophageal reflux disease. Gastroesophageal reflux disease is a chronic upper gastrointestinal disease in which stomach content persistently and regularly flow up into the esophagus, resulting in symptoms include dental corrosion, dysphagia, heartburn, regurgitation, non-cardiac chest pain. Sign and symptom adult. The most common symptom of GERD in adult are an acidic taste in the mouth, regurgitation, and heartburn. Less common symptoms include pain with swallowing, sore throat, increased salivation, nausea, chest pain, coughing, and globus sensation. The acid reflux can induce asthma attack symptoms like shortness of breath, cough, and wheezing in those with underlying asthma. GRD sometimes causes injury to the esophagus. This injury may include one or more of the following. Reflux is esophagitis, inflammation of the esophageal epithelium, which can cause ulcer near the junction of the stomach and esophagus. That called reflux esophagitis. Esophageal stricture, the persistent narrowing of the esophagus caused by reflux-induced inflammation, that called esophageal stricture. Symptom of GRD. GRD in children may cause repeated vomiting, effortless spitting up, coughing, and other respiratory problems such as wheezing, inconsolable crying. Causes of GRD. Frequent acid reflux is due to poor closure of the lower esophageal sphincter, which is at the junction between the stomach and the esophagus. Factor that can contribute to GRD. Hiatal hernia, which increase the likelihood of the GRD due to mechanical and mortality factor. Obesity. Obesity is one of the important cause. Increasing body mass index is associated with more severe GRD. GRD can be a symptom of mast cell activation syndrome, factor that have been linked with GRD but not conclusively. Obstructive sleep apnea, gallstone. Gallstone may induce GRD, which can induce that flow of bile into the duodenum, which can affect the availability of neutralize the gastric acid. The etiology of GRD appear into include the reflux of bile from the stomach into the esophagus, leading to production of reactive oxygen species and oxidative stress, and then inflammation and induction of DNA damage. In experimental model of GRD, it was found that lactobacillus facilitated repair of such DNA damage, indicating the administration of this potentially probiotic bacteria may be useful in patients suffering with GRD for preventing progression to Barrett's esophagus. Diagnosis of GRD, gastroesophageal disease diagnosis. The diagnosis of GRD is usually made when typically symptoms are present. Reflex can be present in people without symptom, and the diagnosis requires both symptom or complication and reflex of stomach content. Other investigation may include esophagoduodenoscopy. The current gold standard for diagnosis of GRD is esophageal pH monitoring. It is the most objective test to diagnose the reflux disease and allow, allows monitoring GRD patient in their response to medical or surgical treatment. One practice for diagnosis of GRD is a short-term treatment with proton pump inhibitor (PPI) with improvement in symptoms suggestive a positive diagnosis. Short-term treatment with proton pump inhibitor may help predict abdominal 24-hour pH monitoring result among patients with symptoms suggestive of GRD. Endoscopy. The examination of stomach with a fiber optic scope is not routinely needed of all patients of GRD if the case of typical and response to treatment. It is recommended When people either don't respond well treatment or have alarm symptoms, including dysphagia, anemia, blood in stool detected chemically. Differential diagnosis. GRD is a differential diagnosis of other causes of chest pain, such as heart disease should be ruled out before making the diagnosis. Differential diagnosis of GRD can also include dysphagia, peptic ulcer disease, esophageal and gastric cancer, and food allergies. Treatment. The treatment of GRD. The treatment of GRD may include food choice, lifestyle changes, medication, and possible surgery. Initial treatment is frequently with a proton pump inhibitor such as omeprazole. Lifestyle changes of treatment. Limit water intake during meals. Limit water intake during meals as it can fill your stomach and put pressure on the esophagus. Avoid large meal and eating right before bed, as lying down immediately after eating can trigger heartburn. Eat slowly to avoid swallowing air, which can reduce bloating. This also allows you to chew your food better, which improve digestion. Eat a small meal every few hours. To skipping meals and overeating, which can worsen GID symptoms. This helps stabilize your digestive system. Adapting health Adopting healthy food choice can also help manage GID symptoms and improve your overall digestive health. Include more fiber in your diet, such as vegetables, fruits, and whole grains. Choose low-fat proteins such as chicken, fish, egg, and plant-based source like legumes. Choose low-fat option such as 2% milk instead of full-fat milk and yogurt, and opt for 20% fat CG. Use healthy cooking methods such as grilling, baking, or steaming. Some food and beverage are acid reflux trigger, so you should consider avoiding them. Alcohol, caffeine, carbonated beverage. Caffeine, carbonated beverage, mint, chocolate, citrus fruit, tomato, onion, garlic, and spicy food. Also avoid their food and fatty food. The importance of carbohydrate, protein, and fat in your diet. Each person reaction of food difference. Therefore, it is important to avoid food that trigger your symptom. Eating healthy protein and not overeating are important nutritional aspects that can help manage GID. Maintaining a healthy weight is also important, as excess weight can put pressure on your stomach and worsen GID symptoms. If you are overweight, losing your weight can help manage your GID symptoms. Dietary changes and GID management. Dietary changes are an important part of managing GID. Following these tips can help reduce symptoms and improve your overall digestive health. It is important to remember that dietary changes should be made in conjunction with their lifestyle changes and medical treatment if necessary. For severe or persistent symptoms, consult a doctor, registered dietitian for personalized advice and treatment. In summary, changing your diet and adopting healthy eating habits are simply yet effective ways to manage GID and problem good digestive health. Medication. The primary medication used for GID are protein pump inhibitor, H2 receptor blockers, and antacid with or without alginic acid. The use of acid suppression therapy is a common response to GID symptom, and many people get more of this kind of treatment than their case merits. Proton pump inhibitor PPI such as omeprazole are the most effective, followed by H2 receptor block. If a once daily PPI is only partially effective, they may be used twice a day. They should be taken 1/2 to 1 hour before a meal. Antacid. The evidence for antacid is a weaker with a benefit of about while a combination of an antacid and alginic acid may improve symptoms. Other reasons like the sucralfate has similar effectiveness to H2 receptor blocker. However, sucralfate need to be taken multiple times a day, thus limiting its use. Surgery. The standard surgical treatment for severe GERD is the Nissen fundoplication. In this procedure, the upper part of the stomach is wrapped around the lower esophagus sphincter to strengthen the sphincter and prevent acid reflux and to repair a hiatal hernia. It is recommended only for those who don't improve with PPI. Thank you.